Welcome everyone to the Behavioral Alliance of South Carolina. Today we are here working through it Wednesday with Alan Pope, the lead school psychologist of Orangeburg County School District. Alan, thank you so much for being here with us. We're going to talk a little bit about mindfulness, trauma, and the impact of COVID-19. As a reminder, everyone, please complete our 5-question survey at the end of this session so that we can better meet your technical assistance and professional development needs. So without further ado, we're going to work through it Wednesday, and I'm going to hand it over to Alan. Thank you so much for being here, Alan.
Thank you, Erin. I'm glad to be a part today. Good afternoon, everyone. And so this afternoon, I plan to talk with you all to share some insightful information about mindfulness and the traumatic impact of COVID-19. Before we start, let's just take a moment to take a deep breath. We're going to take a deep breath and count down from 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Release. Inhale again. Inhale to the point to where your stomach feels as though it's a balloon and that it's expanding. Hold it. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. All right, so let's go ahead and get started. You should feel a slight change. If not, try it again after this presentation. So before we get started, let's take a look at our day. I just kind of do a self-scan to determine how you are feeling today. Just take a moment to kind of ponder how you're feeling, what you're thinking about, to really determine your state of emotional well-being. This session will include an understanding of mindfulness, which is a mental state achieved by focusing one's awareness on the present moment while calmly acknowledging and accepting feelings, thoughts, bodily sensations. You can actually use mindfulness techniques as a therapeutic technique to assist you with adapting to therapeutic techniques or strategies that can be useful for coping with mental health issues, or also with coping with a traumatic experience or an event that could have occurred in your life or one's life that you may know. Today's agenda, I will share with you all what is mindfulness. I will also discuss the traumatic impact of COVID-19 and how to address students' social emotional needs in school settings. I also will provide a mindfulness activity with you all to share today that you can actually do with yourself. You can do it at home. You can even do it with your students. But I really intended for this activity to be for adults, mainly teachers, administrators, and other professionals, so that we, the folks that are in the positions to help students, to ensure that we have the correct and appropriate mindset when approaching the task of helping students within our community, also within the school setting. Mindfulness. According to the American Psychological Association, mindfulness is a moment-to-moment awareness of one's experience without judgment, meaning that you're totally in the moment. You're totally absorbing what the atmosphere feels like, what's around you, what the weather may be, what's the current condition, what may be some factors in the environment or variables that could be impacting or affecting you. It's just truly being aware of the state of mental awareness or mental well-being to determine where you are at that time. You can actually use mindfulness to promote activities. Mindfulness is promoted by activities such as meditation or interventions. You can actually use yoga. Really, mindfulness is anything that can help you stop what you're doing to refocus and to give you a moment to actually reprogram and to just stop for a moment to say, hey, everything is okay. How can I best approach this situation? Mindfulness is actually used a lot for anxiety, because anxiety, we're thinking of things before we actually experience the moment. But once we think of being mindful about things, it helps us to remember that, hey, it's okay You only have to experience it once you go through the experience versus you experiencing it twice by having anxiety prior to the actual event. So remember, mindfulness and being mindful and mindset are very important things when starting the task or when just starting your day. Trauma. What is trauma? Trauma is an emotional response to a terrible event like an accident, a rape, a natural disaster, basically anything that is traumatic that has occurred in one's life. It can have a lasting impact. That impact can actually affect someone up until adulthood if they have not dealt with that trauma. According to Pfeiffer in 2019, research that he published indicated that stress or trauma will instinctively respond in a predictable fashion by alerting the body to a potential threat or action, meaning that automatically our body is going to respond when it perceives a threat or something that is stressful. Our body will automatically respond based on our previous experiences. Do you all know which part of the brain is responsible for responding to trauma? I'm going to skip ahead a couple of slides. It's actually the amygdala. The amygdala is responsible for responding to fear, emotional distress. It's that area of the brain that lets us know we need to go into that fight or flight response. The reason I mentioned the amygdala and mention this part of the brain is because mindfulness can also impact our body response when we're perceiving stress or a traumatic event. By being mindful in those moments, it helps us to determine what's the best decision to make, how we're going to best appropriately respond, given all the information that we have at that time. If we're not being mindful and we're just automatically responding, we may respond in an inappropriate manner. But when we take the moment to be mindful, to assess the situation, to take a moment to breathe, to really make a sound decision, then you're being mindful in determining how you're going to navigate through an event or through an activity or something traumatic that has transpired. So I'm going to go back a couple of slides. I do want to mention the impact of COVID-19. As we all know, COVID-19 has really impacted us all here in America and other places throughout the entire world. Throughout this time, researchers discovered that students were reporting more conditions of depression and anxiety. These conditions were worsening as the pandemic went on. More students were reporting that they were having anxiety and depression. And so those were the main mental health areas, our main mental health diagnoses that were discovered by researchers to have a huge impact on students throughout the COVID-19 pandemic. Addressing mental health problems within the school setting. Schools can actually address mental health problems on 3 levels, meaning environmental, which is to create a supportive school environment, or programmatic, which is to implement programs or curricula targeted at specific issues such as bullying prevention, conflict resolution, and social skills. Or an individual perspective, which will consist of providing interventions to students with chronic or acute mental health needs, such as a learning disability, depression, ADHD, grief, or trauma. On the individual level, it is more so addressed by maybe your school counselor, maybe a mental health counselor, even a school social worker, or even your school psychologist or any licensed mental health professional can address the student's needs on an individual level. A mindfulness approach would consist of steps that service providers take and should follow when creating a system that will be managed and utilized by various service providers, such as routinely screen for trauma exposure and related symptoms, use evidence-based, culturally responsive assessments for the treatment for traumatic stress and other associated mental health symptoms, have resources available for families and children who are been exposed or have had trauma exposure or experiences, engage in the efforts to strengthen the resilience and protective factors of children and families impacted by and vulnerable to trauma. A mindfulness approach can also help assist the parent as well as the caregiver trauma and this impact on the family system, meaning it could be a traumatic event that the family may have experienced. And you, as that mental health provider, could help to, or maybe facilitate a family session to help everyone in the family understand how trauma can actually impact everyone in the family and how they should address it with actually being healed to be able to move forward and address that trauma within the family. You can actually emphasize the continuity of care and collaboration across child service systems, meaning connect with other service providers. If you're within the school setting, you can connect with outside agencies to ensure that you all are doing some of the same things or to see which services you all can collaborate within the community as well as within the educational system to provide the best services to students to address their mental health needs. Also maintain an environment and care for the staff to address and minimize secondary traumatic stress that increases the staff wellness, meaning make sure that your staff is doing well. Every day may not be a good day for all the staff that's in your building. So stop and take a moment to say, hey, how are you all doing today? Or let's just take a moment this morning to kind of reflect on the day, to reflect on the week or how things are going. Take that moment to allow your staff to reflect on their mental health well-being. Facts about being mindful. Being mindful can help decrease stress. It helps increases compassion. Being mindful can give you better focus. And mindfulness physically rebuilds your brain. And being mindful, most importantly, it helps you be more creative. And so at this point, I would like to stop and ask you to pull out maybe an index card or to use even a sheet of notebook paper. And at this point, this is the mindfulness activity. This mindfulness activity is actually titled as Breathe 3, 2, 1. And the reason I titled this activity as Breathe 3, 2, 1, because I wanted it to be a mindful activity that would indicate to folks, hey, breathe, 1, 2, 3, stop, meaning take a moment to breathe. The reason I titled it as Breathe 1, 2, 3 is because, Breathe 3, 2, 1 or 1, 2, 3, however you would like to say it, is because first I would like for you to just take a moment to breathe and to just stop in the moment. The number 3 actually represents gratitude. Write down 3 things that you are grateful for. What are 3 things that you are grateful for? That represents your number 3. The number 2 represents goals. What are 2 goals that you are working towards or 2 goals that you would like to complete? Identify 2 goals. Number 1 represents your why, your purpose. Why are you doing what you are doing? Why are you living your life the way you are living? Where do you see yourself in the future? Your why, your purpose. And so again, this activity is titled Breathe 3, 2, 1. 3 things you're grateful for, 2 goals, your purpose and your why for your number 1. Next, in the state of South Carolina, we're currently functioning under the Mtss Framework. The Mtss Framework does provide a vision for student success for all students that begins with high quality classroom instruction delivered by an effective and well-prepared educator. High quality instruction means engaging students in learning and problem solving while meeting the diverse needs of all students. Good instructions, as we know, is evidence-based, creative, and motivating, yet it is carefully crafted with the culture, the interests, and abilities of the students in mind. Meaning there are a plethora of resources out here available that may address students' social emotional learning needs. But we as the practitioners, the administrators, the teachers, the mental health service providers, we must determine what is the best approach for the students and the staff in the culture that we work within. Because all of those tools sometimes may not be as useful for one particular group that it may be as useful for another group. So be open-minded about which resources or which tools that you would like to select to assist students with their social emotional learning needs. Again, the use of evidence-based literacy instruction is essential for all students and is especially critical for students identified with disabilities or students that may be identified with dyslexia. Last but not least, self-care tips. Be aware of your own trauma. Give yourself permission to care for your mind, your body, and your spirit. Get social support from friends, family, and colleagues. And last but not least, when all of that fails, get support from a mental health service provider to address your social emotional needs, to address maybe your personal needs, or to maybe even address a trauma that you may not even be aware of that you had until now. Whatever that may be, always take care of yourself first so that you can ensure that you are equipped with everything that you need in order to provide service and assistance to all the students and staff that you serve within your capacity of mental health. Thank you for listening. And at this point, I will turn it back over to Erin.
Thank you so much, Alan. That was phenomenal. Really appreciate you sharing. Starting with the breathing exercise helped me, as well as I know it helped many others that were watching today. So thank you for that. Thank you for ending with self-care. What a great reminder throughout. We really appreciate you.
You're welcome. Thank you for having me.
Yes. So a reminder, everyone, to please follow this QR code and complete our 5-question survey so that we can better meet your technical assistance and professional development needs. We will see you all next time at Working Through It Wednesday with the Behavioral Alliance of South Carolina. Thank you all.
Thank you.